Around 5 to 8% of the individuals are morbidly obese and around 30% are overweight. And I feel that's the reason why we have a very high incidence of type 2 diabetes, hypertension, sleep apnea. The key to losing weight and keeping it away for a very long period of time is lifestyle modification.
Hi everyone, my name is Robbie Omondi and welcome back to Life 360. Now Life 360, as we mentioned earlier, we speak about health, and today we've not stopped. Remember, we mentioned obesity, or rather weight, is the root cause of many other diseases. Now, it is my honor and privilege to introduce to you Dr. Mohit, a renowned bariatric surgeon. Now, he's not only known here in Kenya, across the world. I know most of you would want to know why so, because he has made a record of doing surgery in the shortest time possible. When most of you hear about surgery, you think about staying in hospital for a long time. You think about being under anesthesia for a long time. This is not the case. We are here at Third Park Hospital, ready to speak to Dr. Mohit, and allow me to introduce to you Dr. Mohit.
I am Dr. Mohit Bandhari. I am from India. I am a bariatric, metabolic and a robotic surgeon, and I practice weight loss surgeries, weight loss interventions, treatment of type 2 diabetes and intervention based for type 2 diabetes and metabolic syndrome. So primarily the area of my interest and expertise is treating obesity and metabolic syndrome, which is now becoming an epidemic in most parts of the world.
So today we are speaking about obesity and the modern interventions to obesity and weight in general. Tell us about bariatric surgery. What is bariatric surgery?
We have realized that most people who start losing some weight, they are not able to maintain that weight over a period of time with lifestyle modification, like exercising, eating less, sleeping early, getting up early. So, most of the people would fail, and even if they lose, they gain it over a period of time. So if we talk about morbid obesity, we require a very strong treatment, and bariatric metabolic surgery is probably the strongest treatment on earth as of now. So if we talk about bariatric surgical procedures, just to put it in a very simple way, these are the gastrointestinal modifications, as in we cut a part of the stomach or we bypass a part of the intestine, and we modify the gastrointestinal tract in a way that we sort of create multiple effects where 70 to 80% of the fat, sugars or carbohydrates won't be absorbed. If we talk about bariatric metabolic surgery, they can be divided into two parts, and this is just oversimplified. One is restrictive, where we restrict the amount of food which any individual would consume. What we call is to help an individual go into a negative calorie deficit. So these are the procedures which includes a gastric sleeve, where we convert the balloon-shaped stomach into banana-shaped by just resecting a part of the stomach. A gastric sleeve is one of the most commonly performed procedure across the world, and it's mostly a restrictive procedure, where if you cut a part of the stomach, the patients would eat less. At the same time, we have certain hypoabsorptive procedures, where not only that we reduce the amount of food an individual would consume, but we would also bypass a part of his intestine to make sure that the fats and the sugars are not absorbed and in that very large quantity, and certain hormonal effects come into play which treat type 2 diabetes.
Now, in the recent 2 years, we had COVID in the country, and most people came out of COVID with overweight issues and obesity. And speaking to some of your patients, they told us they even had underlying conditions, and basically this is because of the weight they had. How possible is it to embrace now these procedures to ensure that Kenyans are safe from these health conditions?
So, Kenya and entire East Africa, it's actually booming with the obesity epidemic. Around 5 to 8% of the individuals are morbidly obese, and around 30% are overweight in this country. And I feel that's the reason why we have a very high incidence of type 2 diabetes, hypertension, sleep apnea. coronary artery disease and several other problems related to obesity in this country. And I think this is the right time where, as they always say that nip them early in the bud. If we try and treat individuals who have morbid obesity at a very early stage, we do not let them go into deep diabetes or spoil their joints or get severe sleep apnea so much so that it decreases their mental concentration and they have to be on a non-invasive BiPAP machine. And if you go into the root cause of it, that's obesity. Now, if you do a procedure which is gastric bypass, which causes less than $10,000 US, you sort of get rid of all these problems and you need not spend those $10,000 US every year getting admitted into ICUs, going to hospitals, going to different physicians for different problems. But there is one other solution where you spend one time, do a gastric bypass procedure and remove the root cause of all the problems for which you will be spending every year.
So, Dr. Bandhari, you've mentioned about surgery. When most people hear about surgery, they assume they're going to stay in hospital for a long time. They're going to get cut open. They're going to be in hospital under anesthesia for a long time. However, you have a record of doing surgery in the shortest time possible. How does that give assurance to Kenyans, or rather to patients who come to you to get this surgery?
If I tell about my own experience, I have done more than 20,000 bariatric procedures. We have pioneered the largest series of bariatric metabolic surgery in entire Asia Pacific region. And I'm so lucky to have 20 to 30% of my patients from this region in entire East Africa. So our average operating times when the patient inside the OR is around 35 to 40 minutes, even for a gastric bypass around 50 minutes. And we discharge the patients in mostly 36 hours after the procedure. That's an average. Most patients would go home within 24 hours. That's our protocols. So I think the fear for surgery is something which is existent, but we always go and look at our own data. And then we, very honestly put it in front of our patients that you cannot compare the experience of one surgeon with the other, because the bariatric procedure in the hands of somebody else could be an entirely different animal. So we are talking about procedure done last night and discharging patients in the afternoon, where they go home on 4 to 5 liters of oral liquids. They keep on walking, they have no pain, they have no respiratory distress. That's because of very less OR time and a very methodical, well-oiled machinery.
So after doing the procedure or the surgery, is there a lifetime or a lifestyle change that is recommended for patients after they've done these surgeries to ensure that they don't slide back to where they were before?
I'll put it in a very simple way. Your question is very beautiful. Actually, the key to losing weight and keeping it away for a very long period of time is lifestyle modification. Bariatric metabolic surgery makes it very easy to do that lifestyle modification. If I tell somebody to go on a 400 to 500 kilocalories of diet a day, it's not easy. It requires a lot of determination, plus there are several other issues. But yes, as you correctly said, if somebody is determined to spoil it, and patients who are chronic alcoholics, sweet addicted patients who would take soft calories in forms of syrups, would not adhere to any lifestyle modification but would smoke continuously, go on a drug abuse, these are the patients who will not have good results with surgery in long term. Short term, everything is very hunky-dory, but when we talk about long term, these are the red flags.
So now let's talk about Third Park Hospital. What makes Third Park Hospital stand out, apart from Dr. Mohit Bandhari being part of it?
Our association with Third Park Hospital is, it's an year old. And I would say that it's a beautiful hospital because I have worked in other facilities in Nairobi. I am a 7-year-old surgeon as far as Nairobi is considered, and I have been to different hospitals. Third Park is probably one of the most beautiful hospitals I have ever been to in Nairobi. The operating rooms here are world class. If we see, there are every other modality you would talk about, a 3D, a 4K, 8K, all cutting edge technology for operating. The intensive care units are fantastic, very equipped. And the most important thing is the staff. So we have the anesthetist. And I have worked in India with, great anesthetist, big team. We run 6-7 ORs at our own center in India. But the anesthetists here are, class apart. They are very good in terms of the pain management, in terms of taking the post-op care of the patients. And I can say that this is a center which has zero mortality. I mean, we have done, more than 50 procedures. It's just, some couple of days when I shift my practice. So I think the infrastructure, the staff, the anesthesia, the post-operative team, and obviously the beautiful rooms. When you enter inside a room, they are so well built. The light comes inside, it's so well, the air is there inside, the circulation of air is beautiful. So everything is superb. Probably this is the best setup I have ever worked for bariatric metabolic surgery.
Generally, healthcare in Kenya is quite expensive, and these procedures are much needed to most Kenyans in general. How much should a patient have, and is it possible to partner or work with insurance companies to ensure that maybe the weight of these charges are lifted from the shoulders of these patients?
I think bariatric metabolic surgery is moving towards insurance. In India, we have 100% insurance coverage. I think most companies here in Nairobi are also coming and giving insurance. At this point of time, if we see the health system of Nairobi, it's a little limited to around 10 to 20% of our patients. But I'm very hopeful it would be almost 100% coverage in 2 to 3 years from now. At this point of time, because we have to understand that we are providing world-class facilities, beautiful rooms, cutting-edge ORs, and the best bariatric team, not only in terms of skills, but the most experienced. There is a cost to the entire structure which we have built in, because it comes with safety, it comes with experience, it comes with a lot of several other things which are important for a patient who is doing bariatric. We are keeping our cost to around $8,000 US to $10,000 US. That's the basic price bracket here. As time would pass by and more insurance coverage would come into picture, I think this price is going to come down drastically. And that would be better for Kenyans and for people for entire East Africa, because Nairobi is a hub. It's not a place where only, people from Kenya come. It's from all other parts of East Africa, they come and do it. And in fact, I have a couple of inquiries from South Africa now. So we will get patients from as distant as Cape Town and several other places in South Africa. So it's going to be a hub for bariatric surgery.
Now, speaking to one of your patients yesterday, mentioned that they avoided a surgery because now they had undergone this procedure. How does that happen, and how possible is it for more Kenyans to realize that this condition I have, or rather this illness that I have, is not actually the root cause? If I deal with my weight, I'll be able to actually finish up all other issues.
Obviously, I would say that weight loss is something which everybody should try. One has to be very aware of the fact that obesity is going to kill, because it will come with a lot of other diseases. So if you have obesity, you will get diabetes, blood pressure, sleep apnea, and several other problems. It's a conglomerate, it's not one disease. If they do not adopt to that lifestyle modification and they do not do surgery also, they're going to get worse. And these diseases are going to increase the cost of medications, and it will be a burden on the healthcare of Kenyan economy, which we do not want, and it should be the last thing to happen. It's a growing economy, and a growing economy is dependent on its young population, the productive population between 20 years to 50 years. And if they are crippled by obesity and they do not have the awareness, then we see, trends which are not very heartening. So that's the message.
Thank you very much, Dr. Mohit, for joining us and speaking to my audience. And I hope that they'll be able to come here, ask questions, and be able to get help regarding their weight journey and weight loss journey in general, and actually fix their health. It was an honor.
Always available. Thank you so much.
And to you, my audience, I hope you've learned one or two things about bariatric surgery. Feel free to visit Third Park Hospital, speak to the doctors, speak to the experts. Remember, I'm just a conveyor of information, and when you visit Third Park Hospital, you'll be able to meet experts who will take you through your health and wellness journey and be able to live a healthy and longer life. Until next time, my name is Robbie Omondi. This is Life 360. Consider subscribing, hitting the notification bell. We have so much lined up for you. Bye-bye.